Now, to a conversation that we continue to follow up right here on NTV. Our colleagues on NTV Sasa had a whole group of elderly people in studio yesterday speaking about the challenges that they face on a day-to-day basis. And of course, this was brought about by that feature we brought to you by Gertrude Mwangi called Old in the City, which laid bare the challenges they have to live with and of course some of the gaps that are in the system in taking care of the elderly in this country. Now, to put some perspective to this, Kenya is estimated to have about 2.9 million people at 65 years old and above, according to the 2009 national census. Now, with the census coming up next year, it will be interesting to know where that number is at. Now, population experts estimate that the greatest growth globally will be felt in Africa, where health systems are unprepared. Now, we know about our own challenges when it comes to the health sector, so it will be interesting to know how that has adversely affected the elderly, to have more conversation on this, the policies around that, and of course the challenges and what the society can do in helping alleviate some of the challenges that the elderly have to live with. With me in studio is Gertrude Mwangi. Asante sana kwa kuja. All right, she is an elderly person, I believe. Miaka umefikisha ngapi? 70. Yeah. Asante sana kwa wakati wako. Elijah Mweiga, who is a founder of Karika Kenya, which is a home that takes care of the elderly. Thank you for your time.
Thank you.
And of course, Dr. Muthoni Gichu, she is a medical, let me get this right, gerontologist, and with the Ministry of Health. Now, as we start off this conversation, I think, Daktari, it would be prudent if you defined for us what a gerontologist is.
All right. So, in simple terms, a gerontologist is a person who studies aging as a process and issues of older persons. There is also a geriatrician, who, for example, the doctor who treats children is called a pediatrician. So the doctor who treats older people, they're not elderly people, the older people, is called a geriatrician.
Okay. Yes. So, if I got this right, there's only one medical gerontologist in the country, and that is you, and 2 social gerontologists?
Yes.
Okay, paint the picture for us and why we're doing well as a country or not.
Okay, let me say this. Right from the olden days, and I'm sure they can agree to this, we have had, let me say, growth. Earlier on, our concern was to have our babies live beyond the age of 60, right? And we did a lot about it. And that is probably why the youth in this country are actually almost half of the population. But again, probably we never saw it coming. The health systems have improved. So that means we have more older people. We have more people living longer because the health systems are able to support what I would call the communicable diseases that would wipe people quite fast. So that means it's good. And also, as technology came, as urbanization came, you know, we get to live longer. Maybe in another decade or 5 decades from now, we'll be where Japan is. 35% of Japanese population is 60 and above. So 60 is still young there.
Yeah.
So we're getting there very soon.
Okay.
Hopefully.
So going by the 2.9 million people who are 65 years and above, vis-a-vis just one gerontologist, I mean, there's a lot that needs to be done, but we'll be getting to the details of that. Now, Elijah, let me bring you into this conversation. You deal and take care of the elderly on a day-to-day basis.
Yes.
Now, that number is clearly rising by the day. Yes. Now, some would wonder why that would be rising, considering that we say that we're living at a time where people are dealing with lifestyle diseases, you know, and what have you. And also, some of us who understand that the elderly are outrightly, you know, taken in by their extended families. So in your experience, why do you find more of these people coming to you for help?
I think, yes, older people, there is perception in Kenya that the majority of older people are taken care of by their families. But what is the reality outside there? You'll find that in Kenya, we have a lot of older people who, as a result of lack of employment or lack of jobs, young people could not take care of them. Majority of our young people, they go for greener pastures, sometimes outside the country. What happens to that older person? The same case, it has been a reality, even through media and all the others, that the government says there are no jobs. What about that young generation which used to be there? They are now grown-ups, but they cannot take care of themselves, neither of their elderly people. I have an experience. Sometimes we think that older people are rich and well-to-do because they are the custodians of the properties in Kenya. But there before, you remember, our parents were giving birth to so many children. As a result, when the older young people grew up, they had to take up some of the properties from their parents. And yet, there are no jobs. What do? They expose the properties, and the elderly people remain without support. Like where I come from, every day, the older people come there. And what they really cry about, it's not even the property. It's the isolation in the places of their households. Yes.
Okay. Okay, maybe to, you know, paint a picture of the challenges they have to live with. Gertrude, miaka 70 umefikisha. You live in the home, the Karika home. Ulifika hapo aje? Na kwa nini ulienda kule?
I use Kiswahili. Okay.
Oh, are you okay with English? Okay. Tuonge shosho ni sawa.
Not very much, but okay. When I joined the Karika, it was sometime back about 5 years. 2011, when I joined Karika. So we had rumors saying that there is money which is given there. So there are some ladies, even young, I call them young ladies, but they are, they came to me and said, oh, so, let us go. There is money somewhere. So that's the time when I joined. When we went there, we didn't find any money. So we find a man, just our leader, as talking something deep. To me, it entered into me, because he had focus about old people, their life, where they live, what to eat, taking care of. So it touched me. From that time, he elected me to be one of the leaders. So I'm one of the leaders.
Within the home?
Within the home. Okay.
How was it before you came to Karika? How was life at home with your family? Do you even have family?
Let me say yes, I have good family, because I had one girl, she passed away. Then the other two, I had 2 boys, they disappeared in Sudan. So now I'm left with one boy who just married just recently, the young one. So when I was working, it was okay. But when I retired, that's the things became worse.
How? Because
the one who was taking my my life like to be the way I should be, the one who passed away. Then I left when I'm hanging. But all the same, I tried to find out what to do. So I started, I went to the government and I was given a license, you know, like a letter or a certificate to have a bureau for to take girls to the house girls, our house managers. Yeah. So as I'm in my house, so that work, it doesn't do the way those people have go to offices. Yeah. Because I told the government that I can't go in the office, kimbia with the state council, what. They said, okay, it's all right, do it in our house. So if somebody comes for you, for a girl, so the money which will be given to you, 1,500, that will be helping you. You know, it is scarcity. It is not the way somebody can earn. So the life, even in the way I'm staying, it is a slum place. All the people there, they are not in a good condition.
Okay, so now that you touched on the fact that you worked until you retired, had you put some money away to take care of you when you were older?
I was in the private sector, and I had money in the safe. That's what we keep. But when I retired, the children were still young, so I withdrew all of the money and educated my children. So I didn't have anything. The income or whatever I was thought of doing, I was investing in my children. The girl who was just, you know, knowing now she's going to do something, and she got a job. She was earning 50,000 per month. The first month, that's when it passed out. So I left the way I am. And I thank God because I'm saved. So I stand on my God, and He provides. But some other old people, they are suffering.
Yeah. We'll get to the details of that. Now, Daktari, just listening to Gertrude, something that comes to the fore. Question, what happens to the money set aside to take care of you when you're older for those that have their avenue to do that?
I like where you're taking this conversation for one or two reasons. Number one, how much can money do for you? Even if you had all the billions, how much can it do for you? And this is a place where we need to actually learn about or appreciate the beauty in relationships. Because again, you could have all the money, yes, but it may not do much for you. But when you have stronger relationships, number one, you'll never get lonely. The one thing they will tell you is that the thing that really destroys them and probably kills majority of them is loneliness. So you can buy company, but at this age, we can actually, you know, afford to do that. Again, money is important, yes, and it is good to save for that time. But again, how are you doing your savings? Is it something that can keep you going? Because again, we could save in a way that the only option available is for me to use the money, not the money working for me. So if I save in a way that I can only withdraw the money, it will definitely run out. So again, when we talk about investing, how are we going to invest? So that whatever I have invested in now can comfortably take care of me then, and probably for generations down after I'm gone. Yeah.
True. Elijah, I mean, the economies of scale have to come to play at this point. I mean, you mentioned earlier, the extended family will say, hatuwezi, we're all dealing with the same economy, this is the most we can do. Yes. She has mentioned 2 of her children went to South Sudan and disappeared. Yes. How many of those stories do you hear?
Oh my God, every day I have a lot of stories. Sometimes you are exhausted. Let me tell you, there is a need to react on this on a very serious note. Much as you talk about what is going to happen tomorrow, our population outside there are suffering, are crying. And I like the way she has answered you about the money. Money is not everything. Remember, human beings are social animals. What happens to an older person who is used to stay with his children or her children, and then they have all departed? Loneliness. Then, much of that, how I see like the government is moving, they are really appreciating that they are older people. But that is not all. We are supposed to look at the issues of well-being of an older person holistically. When we talk of cash transfer, yeah, that is good. It is support somehow. But what about the social side of it? I sometimes wonder what happens to our leaders, because they always think about the youth and the sociality of the youth, leaving behind the issues of an elderly person, and you ask them, all of them, nobody want to die young. They all want to grow old. What are they doing to prepare for that age coming? Yes.
Okay, that's a very good question that we will answer. But for Gertrude, you talked about that the elderly that you represent at the home and many others out there are suffering. What are some of the issues that you deal with on a day-to-day basis?
Firstly, let me thank the government to give her that cash transfer. Sometimes it helps, yes, but a bit of our lives. They mention about food, eating in the house or where they are. The food is scarce, they don't have enough according to the money which are given, and the lady is not, she or he is, they are not having something else to be done. But some in my group, they have small business, selling bananas, sweet bananas, or selling sukumas, but not all of them. Some they are very old. Food, as I said, clothing, shelter, they cries transport, they are sick, mess on them. So many things are coming to them. And they are suffering, they don't have anybody to help. They are waiting for that money about 3 months to come. When they are given that money, or 2 months, you are going to get 4,000, you pay house rent, you eat, medicine. So when she comes to you, you see that all real, and you have nothing to help. And just recently, yesterday but one, so Guka came to the meeting. Then he collapsed. When we tried to find out what's going to his stomach, he didn't eat anything. We don't know whether he's having a problem of that disease which you have, arthritis, or whatever. He collapsed. So we ran all to the floor. When we gave him not medicine, something to eat, something to drink, he woke up and and tried his way going home. Now remember where he's going. Is there something to eat? So we have got a lot of things. That's why we are crying. It may be you asking sometime.
Okay.
Let me leave it.
All right. It's really sad just listening to that story. An old man of old age, I mean, collapsing because he did not have something to eat. And this is just one of the challenges they have to deal with. And the biggest one of them has to do with health. And I think that's where we need to go right after we take this break, as we have our gerontologist, and the only one in Kenya. I need to keep mentioning that because there's somewhere we're going with this, to just show how as a country we are investing in taking care of the elderly, and we'll be getting back to it right after this break. Welcome back to NTV Today. My name is Gladys Gachanja. The conversation today is Kenya's aging society. We have over 566,000 people who actually registered for the cash transfer program by the government. They get 2,000 shillings as a stipend to take care of them on a monthly basis. The question is this enough? Of course, speaking to Gertrude, who is 70 years old, and Elijah, who is running a home for the elderly, and Dr. Muthoni Gichu, a medical gerontologist. Clearly, this is not enough. So let's get to the nitty-gritties of this. Kenya, as it is, lacks a specific law both at the national and county level to actually promote the rights of the elderly. And when we talk about the rights, we're talking about basic needs and health and what have you. So to start with, there is a bill in Parliament. It has been going back and forth. As somebody who walks the talk with the elderly, what do you feel about it?
I think this is a double-edged sword, I could say that. And the reason why I would say that is because, I'll give an example. When the youth need to be listened to, they can actually voice it out. On the other hand, for older persons, they have been, you know, it's your finished mileage. So they do not have voices as yet. And that is one of the most important things, and very crucial at this time as the numbers grow, is to grow capacity for the older persons to be able to speak for themselves. Because again, look at me, and I'm speaking about an 80-year-old, and you're wondering, what do you know? You know, but it's a good thing that the first time I met with Elijah, first thing he told me is that, ikazi hawezi. You know, and like, it is all right, we'll grow together. But again, it's good when the people, the older persons themselves, can speak for themselves, because they know where the shoe pinches most. And again, we are human beings. And you know, when somebody asks you, when somebody tells you, unajua unazeeka, how do you respond? I want to say, no, mi si mzee.
Oh yeah.
So we're in denial.
We always deflect how old we are. Yeah.
So we're in denial. So we need to accept that first, and then now we're able to plan and take the journey. You know, I keep saying, I like relating this to, for example, HIV. HIV was something that was very stigmatized then, but now it's an everyday thing. Aging right now is stigmatized. As in, by the time somebody is telling you, they're already cutting you off. And then we forget that these people have had experience, though you can get anywhere. But they themselves also need to accept and know that they're not finished mileage. They have a lot that they can do. And like you rightfully said, the 2000 may not be much, but let's as in get realistic. It wasn't there before then. I've met some older persons who say, our president must be very good because I have never had a salary. And he's taken me, you know, now I feel what somebody who has a salary feels. And you look at them and you're like, wow, beautiful. Yeah.
2,000 shillings means different things to different people.
Precisely.
Now, Elijah, I know you're very passionate about the laws that are not in place to take care of the elderly. I mean, when you see other things being prioritized, and of course, the health is one, universal health is one of the pillars of a Big Four agenda. What would be your take on the same in as far as the elderly is concerned?
One, I pity our country. I pity our country because now we are guided by Vision 2030. Yes, we talk well of Vision 2030, but we are not taking the way we should approach it. Remember this older person who is taking care of a grandchild. The older person has no food for this grandchild. A child who is brought up by a grandmother or a grandfather, many a times they become notorious, isn't it? And because this grandmother doesn't have food, or maybe will not be able to control the child, this child will grow up being a notorious. So the children who are 10 years, 5 years today, by 2030, they will be 20 years. These are the people we shall be calling the youths. If we did not help them when it was supposed to, then we start calling them when it is too late. Therefore, I see a gap that will be a difficult thing to address during that time. I'm not happy really with the steps that the government is taking, because I know the government of Kenya could do more than what they are doing. Imagine 2,000 for a whole month. Somebody who is arthritic, who is diabetic, who is high blood pressure, and the 2,000. Are the many things that are not spoken here, and I'm happy to be here, is that what is the population of older people in Nairobi City? Majority of them are living in rental houses. We talk of giving them 2,000. How much is one room in Nairobi? That's the question we should ask ourselves as citizens. Even as the government is taking the initiative, we as the young generations should start helping the government to come up with a realistic amount that could really help people. You have said it well. 2,000 means a lot to some of our people. While 2,000 is like nothing in Nairobi. I want to say an example. Money always go and come and go. We have seen people who used to have a lot of money, they die very poor. Why don't our government take it this way? I suggest. Let us have a unique card, recognizing the older people, maybe at an age that is set up by the government because they realize this is our budget, it can only cater for this number. This card be able to allow an older person to travel and go and see a grandchild somewhere, to go and they even get an exposure. This card allows the older person to go to a supermarket, buy the food of her own interest, because we have the right to choose what I want to eat. Why don't we have those cards that can allow an older person to go to hospital, be treated without being charged? And even if they are charged, let it be charged at a half price. I have always been thinking of those who are retirees in Kenya, who used to work. How much are they getting? Are they really comfortable? A case study in Dadora. 1978, because I was here, that is when Dadora was coming up. Those young people who used to buy those plots and they owned the plots, they had the chance now to say, I am earning something from the houses. They are the same parents today who have their children occupying the rooms that they used to rent, and therefore they cannot raise money from the same plots. What will happen to Nairobi in the year 2030? All those people we used to call landlords will be beggars on the streets because the children are taking over. When we talk of health issues, and I like this, now you have heard, we have only Dr. Muthoni as a gerontologist. I started thinking of issues of older people when I was about maybe 15 years back. Now I'm over 60. I'm qualified to be treated as an elder person, isn't it? What am I expecting from the government? It's only 2,000. And when I go to the hospital, how many times I have cases of older people going to hospitals and they are referred as it's about age, not ailment. When shall we have doctors who can listen to the older people and even examine before they can conclude? We are equally human beings. We have equal rights. When we talk of Kenya and the elderly, and especially aging in the city, it's really pathetic.
Yes, it is a dire situation. I mean, with 2.9 million people who are elderly, that is a huge number in a country to ignore. And speaking of which, if we can get those details up about the provisions of the NHIF super cover that we all know about, and this is the Kenya's largest reliable, accessible and affordable medical insurance cover that enables you and your family to enjoy an unparalleled benefit package. Now, what that super cover actually gives you is an outpatient service, and that could include consultation, laboratory investigations, drugs, health, education. I mean, even what they are always told to pay for, like MRIs and scans. Then it also gives you leeway to get inpatient services, maternal care, antenatal and prenatal care. There's reproductive health services, overseas treatment, rehabilitation of drugs, surgical procedures. I mean, the list goes on. And all this is supposed to cost somebody 500 shillings per month, and that should be able to cover both the principal members and beneficiaries. Now, I think this is a part where I ask Gertrude, for 500 shillings, first, are you able to get these services, or are you even part of a super cover as an elderly person?
Yeah. I've got I was given, we are given cards to go for NHIF.
Who gave you? Coordinated from the home?
Coordinated through the National Hospital Insurance Fund.
Okay.
And we are given, but they are not working.
What do you mean?
When you go there, let's say for example in the hospital and you are suffering like me, I've got a problem with my legs, my knees. So they say that there is no money to your card. Go and buy medicine. Remember that 500. The government said that he has given us that money, and when you go there with that card which is paid, there is no money to your card, and you go buy and buy. So that 500, I see as it doesn't work.
Okay, Gereka, let me bring you back to this conversation. Please. In your case,
yes,
do you remit this on their behalf, or how does it work for the elderly? Because I can probably give the 500 on behalf of myself and my beneficiaries. For the elderly person, what happens? How does it work?
In the first place, I started by calling for friends who can sponsor these older people to register them with the National Hospital, and they could sponsor the pay. But you know the economy today, many sponsors, they run away. They can no longer make it. But here comes the cash transfer for the older people from the government. And they say once you are registered, then you are benefiting for NHIF. What happens then, and this is something you can come and witness, older people when they go to the hospitals, and especially even here in Bagathi, I have cases where older people have gone there for treatment, they are returned back because their cards are not accredited. So I wonder what is happening. When we go to the Ministry of Labour, who are also good friends of us, they tell us that all those who are registered with the cash transfer, they are eligible for the National Universal Cover. When they go to the hospital, then they are returned back, they cannot be treated. I've been going there, and they always tell me that NHIF only operates when they are allocated the finances. If they are not given, then they don't give the services. So why I've talked about this is because it is a day in, day out issue in Karika, and I wonder if the government is really serious about this. If so, who is this in charge who is not limiting the money? Because older people are crying, are dying. The other day I took an older person to hospital to Bagathi, and yes, he was subscribed some medicines to go and buy. You have read it. It's supposed to come from the NHIF cover. Why are we buying then? So I think the central government has a goodwill, but when it comes to the implementation unit, there should be something wrong.
Okay, it's a good thing you brought in the government here. Now, our gerontologist in the room who comes from the Ministry of Health, help us understand where are the gaps here. I mean, we have a cover that should essentially take care of the elderly, but when they go for those health, to the health facilities, they do not get the services that they need. What is not happening?
Okay, I will say every system has teething problems. Remember, this is the first time this is happening in this country. 5 decades after independence, number one. Number two, even the NHIF process itself has steps that need to be taken in. For example, I am covered under NHIF, and I need to select the facility that I will go to. And if I do not select my facility, I will have an issue at some point, right? And these are some of the issues that are likely to come up. And on the other side, it is good that you have brought this up, because I was having a conversation with a couple of older persons in the field yesterday. And for example, now there's a cash transfer, or what is supporting the older persons for 2,000 every month. And from the 2,000, because again, if they are told that it's not paid, although they probably have not selected a facility that accept, or what we call your point of service, the facility that you go to receive your services. So it becomes a bit tricky when you just present yourself into any facility. And then having the 2,000, it means like I can keep aside 500. And this is the kind of mathematics we were doing yesterday. For somebody who's, for example, in the village, 500 is, you can only use it to pay somebody to help you in the farm for 2 days. When you go to, when you're covered under NHIF and go to a hospital, how much is 500? Or how much can 500 do for you at that time when you have it in cash and not insured? It will not probably even pay your consultation. So it is one of those things that we buy, but we don't, not really need at that point, but you know what insurance says.
Yeah.
It covers me for things that I had not planned for, because nobody plans to be sick. On the other hand, it is crucial for actually for all people to invest in the preventive health. I know preventive health doesn't mean that you have to go to hospital. You know, it's like the way you service a car. We take our cars for service, but do we take our bodies for service?
Rarely, because it's costly.
Really? It's probably the cheaper option, and that's why we don't go for it.
Yes.
Yeah. So if we can afford to take a car which I can buy spare parts for service, then what about the body? And here we're talking about very basic things. Earlier on you had talked about the lifestyle diseases. These are things that we do that have a consequence. Meaning there is an option of doing something differently that will give you a different outcome. Yes.
Okay, I see Karika is really burning.
I just wanted to mention something she has just said. The issue of selecting your point of service getting should be revisited, because our constitution allows us to travel all over Kenya, isn't it? Older people are prone to diseases, and they travel up country from Nairobi to Mombasa to other areas. What happens when they travel to see their children and they fall sick over there? Must they be brought back to Nairobi where they selected the service? So there are those implementation challenges I think should be addressed. And of course, as National Hospital Insurance Fund, it is supposed to serve everywhere in Kenya. This is why whoever is implementing this should reconsider. There are children who left Garissa to come for greener pastures in Nairobi. Their parents want to visit them. When they come here, they are sick. Where do they go? Must they be taken back to Garissa? So those are some of the challenges I find with our implementation team. And also I want to commend the government. Of course, sometimes back we never used to talk about this. I've been wondering why it was called National Hospital Insurance Fund, and it was only serving the contributors. Thanks to the government, because now it can reach more. But let us implement it in a proper way that can be accessible to every client. Yes.
All right, again, yes.
That applies to cash transfer. If somebody is getting money, is a beneficiary, and is staying in Kakamega or Western, let me say like that, is applied in Nairobi. So when the money comes at 2,000, he transfers from there to come and get that 2,000
Here.
So we find that is a very big challenge. Why? Because there is Post Bank everywhere, Equity all around. Why don't that one put in action to see if you are in Kakamega or in wherever you are, to get that 2,000 where you stay, instead of traveling, coming back to Nairobi.
A very good point there. I mean, if we were dealing with over 500,000 elderly persons that are actually registered with this program, and they are across the country, it would be very I mean, you can only imagine them trying to get all into Nairobi in their frail nature to actually get these monies. Or how does it look like from the ministry's point of view?
Okay, that is under a different ministry.
Okay.
But from my interaction with the older persons on ground, that is actually new. Because, like, actually yesterday, I happened to be on one of, the field visits. And I found these people actually being able to collect the money from the nearest, what do I call it, banking institution. That is what my experience has been, including as early as yesterday or as late as yesterday. So maybe that one.
But maybe I think what needs to be done is more sensitization even for those that either give care to the elderly or the elderly persons themselves to know that they can actually access these monies from any bank or money outlet. Kirika?
I want to say, yes, it has been a milestone today because the ministry authorized several banks to do this cash transfer. But there before, it used to be you have to get your money where you earn. And the one thing I like about 70 plus, the current program which is going on, is that the government came up with, you have to have a bank account. This bank account you can open to your bank of choice. This one would address this problem, but also remember we used to have those who are registered at the 65 and above. Those are the people who are now suffering, and for my case, I know quite a number of older people who used to get this money and were registered here in Nairobi, but they have relocated now because now they are able to go back to home. Kakamega, Busia, and all this. Now, the worst is, if you transfer the pay point, it has its own implications. But why don't we allow them also to have their bank accounts in their residential areas so that this money can be sent to those particular banks? This will relieve them of the burden of transportation to Nairobi, picking 2,000, and sometimes you are paying 1,000 to come here. So it becomes, and it doesn't serve the need. So that's an area I think the ministry should address.
And we are referring to the Ministry of Labor, and we actually reached out to the social society department for them to come and join us, but they were not able to do so, and some of these questions actually fall right on their laps. Now let's go back to the health, which is what I think is the biggest impediment, especially for most of them, because as they grow older, many of these either lifestyle diseases or just age-related diseases catch up with them. Now, on the national level and county level, how is it looking in as far as your field is concerned?
All right. To begin with, we need to demystify something. Age is not a disease in itself, but definitely there are changes that take place as the body ages. On the second note, for us to have, as in other ministry, for there to be a unit that actually looks at issues of older persons, means we're ahead of many African countries. On a third note, when we look at our policies, our current policies, they're all bringing in issues of older persons. That is including the ongoing debate on universal health coverage. So that tells us or shows us that we are, we're making good progress, that I would say, as a country.
All right. Now, as much as we're making those strides, what are some of the gaps that need to be looked at immediately? Because clearly, with all the suffering and the numbers increasing more than we are prepared to take care of them, what are some of those stopgap measures that need to be addressed immediately?
Okay. First and foremost, we need to get data on older persons and their health and well-being. Because you look, for example, if you look at health service, majority of them don't give or even collect any information on older persons. So those are also debates that we are currently having. Secondly, we need to acknowledge, because again, aging, you just don't learn from Mars and you're 80. So we need to acknowledge the fact that we are growing old. So we need to bring in, this is at an individual level, as in other than the national, because again, the government would come to your house and do everything for you.
Yes.
So we need to agree that and accept the fact that each day we grow older, and we need to live or employ healthier health habits that will support us through our lives. I keep saying it's actually possible to push the lifestyle conditions to very late ages in life. But again, it has to start as early as possible. When you talk, why do we talk about breastfeeding for children? It's because the implications thereafter in life are quite huge. So at the policy level, I can say we've made good progress this far. In as much as we need to grow more and have more human resource addressing the issues of older persons. And sometimes there's something that was said earlier, that a good number of older people will go to the hospital and they're told, where's mgonjwa nyuza inakusumbua? You know, that's a common statement. But again, like I said, we're all in denial that we're growing old. So we need to actually look at attitude. You know, health is not the mere lack of, as in, it's not just the absence of a disease. Health is wide. And Ministry of Health alone cannot actually successfully deal wholesomely with health issues. There's a question actually, because again, where you live affects you in many terms, physically, psychologically. How you live affects your health eventually. What you eat, as in health, Ministry of Health does not produce food. We need agriculture in there. When people are not able to move around, and then how do we plan our cities? Are our cities friendly? Are they age friendly? Let me ask that. When you're putting up your apartment somewhere, is it age friendly? You know, we need to rethink this whole thing and plan appropriately for aging.
Okay, now Elijah, when you put up Karika Kenya, you wanted to help the elderly because you saw a specific need. Now, you mentioned earlier that you actually run a daycare center for the elderly. How do you go about taking care of the immediate needs?
Thank you. Before I answer that, let me tell you, Karika is an acronym that stands for Kenyan Aged People Require Information, Knowledge and Advancement. It's not just a word. It's out of a research I did, and I found that majority of older people in Kenya have no information of their rights. Let's go to our constitution. It says, yes, every Kenyan has a right to treatment and to food and to shelter and all this. You'll find that when we look over issues of treatment and health, go to Kenyatta Hospital. We have children department, we have general wards, and the issue of dignity is not there. Especially when you break your leg, you are told to, you are posted to the general ward with your children there. What about the biblical side of it? We talk of a child should not see their parents' nakedness, isn't it? There are so many things that they need to be done. Thanks that you have invited us here. We have to tell the Kenyans their work to be done. And now that aging is even progressing to the older people, they have to wake up and start thinking and planning. Why I came up with Karika is because I noticed many older people in our local community, they were suffering. You can, for example, come to Kawangware market. You find small children gathering the food that is spilled outside there, and they bring to the grandparents, who then in the evening, they put their foods on the roads, they start selling. Why? They do this because they have no source of income. I started by distributing food, giving food to these old elderly people. in the chief's camp. But later, I saw I don't want to go on creating a dependency syndrome to the older people. This is why I came up with a center where they can do their own income generating activities which are age friendly. I want to say this. The government and the community should rethink on social aspect of older people, where they know older people, they are not as old as useless. When you come Karika, you'll find them, they are weaving baskets, they are doing beadworks, they are making their own detergent soaps, and they are elderly. Like her now, she's reading a group of older people. How I wish each and every sub-county and even location should have a center for the older people. Remember also, it's not everyone who worked in the government or even in the private sector ended up growing with a lot of money. And sometimes they have a lot of knowledge. How I wish all the retired nurses, all the retired doctors who are elderly could have a department in Kenyatta to address issues of older people, because they carry the burden. They know what itches the older person. I want to say Kenya must start rethinking, and also a very important point here to raise. It's only the older people who blesses the young generation. When President Kenyatta mentioned about a caste transfer for the 70 plus, all the older people were happy. As a result, we had the golden handshake, which brought peace in Kenya. Congratulations, President Kenyatta, wherever they are, and Raila Odinga. Because they did this, now we are in peace. What happens during those violent times to the elderly people? Who addresses the needs of the older people? How they suffer in the community, and the young children are on the streets, the tear gases in the community. Who are most affected? When we are talking of a population growing, let us think on the implications of getting old in Kenya. And let us be realistic, because yes, we talk much of elderly people today, but when we are in the offices, we don't implement what is supposed to be. We shall be victims of what we failed to do tomorrow.
Very true. I like the way you put it, that being old does not equal to being useless.
Yes.
And speaking of which, Gertrude, he has mentioned some of the activities that you engage in, because it also keeps you up and about, it keeps you agile. What are some of the things that you've been able to do amongst your group?
Even there have been sewing there, our group. We make viondos, beads, as my leader says. We make that soap, and when you come to our group, there is no kind of smell of aged people. You know, old people, they do smell. It is true. Old people, they do smell. They have got their own smelling.
Okay.
But when you come to our group,
yes,
no any kind of that, because we have got soap, we wash our clothes, we bathe, and when we go home, we are clean.
Yeah.
And we do it even at home, not just there.
Okay.
And you know what?
Yeah.
They have a very good choir, which is not recognized in Kenya. Older people who are doing a very good choir, singing and dancing.
Okay, you
Yes.
sing and dance.
You will see us. We
Okay, now I'm sure you can see how she lights up when she talks about these things. I mean, Shosho, when you think about who you are before you joined your fellow people at Karika and even other older people out there, what is that one thing that you have found amongst yourselves that keeps you going?
To me, I became young to join Karika, because if I was there, and as I told you, my problems, I would have gone. But because now I'm in Karika, and our leader told us that you are not old, but you are growing. So we are still, every day, we are growing old. We are growing, we are getting old, but we are not old, but we are getting old. So now I've got life. I've moved to so many different places. Mombasa, visiting old people. Where we found Cliffy. Oh my God. Try to go there once. Those people, the people there, they are in danger. They are not the way we are. And if we have got a group, we can go there and make Karika somewhere there. You know, the people have come to visit Karika. They found that Karika is different from the other old people. So to me, I became young.
Okay.
And I'm proud of staying with the Karika.
That is Shosho Gertrude for you. Now, Dr. Muthoni, even as we close this conversation, I think we've touched on things that are very important, especially in putting in place the right policies to ensure that our elderly persons are taken care of. I mean, what are those things that you would call out on society to put in place just to make it a little bit easier for this generation?
First, we need to begin with getting away with the stigma. And stigma here, I mean the way we look at older persons, knowing that someday we'll be there. I keep saying there are two ways to this life. You'll either see old age or exit before you see it. So what we do today actually really matters. Secondly, the older persons themselves, when they're together and they have that connection, you know, and that social
communion?
Yes, yeah. It means a lot to them. As in, it actually means more than the money. As in, you've had them. And supporting them through the social groups or the networking is very important. And probably the other thing I would like to say is we have a few issues, yes. We may not, like now I have experienced a good number of older persons who get admitted to hospital, but because they feel the environment is not comfortable for them, they want to go home. So it is very important for health promotion to be among the older persons also. And this is where I ask, we talk a lot about children, a lot about adolescents. Why do we leave the older persons? Are we trying to say that the older persons don't have needs, don't have wants, you know, even basic life wants, you know? We need to look at how we deal with or treat the older persons right from where we are at. I believe a few years ago, it was very easy for somebody to, for example, work in a matatu. And when there's an older person, the younger person would stand up. Do those things happen today? I'm not sure if they do. And I liked, there's something the president talked about, having the people with, our public transport accommodate people with disability. It also needs to look at accommodating people who are older, so that they can also have time to engage in social activities.
Just to bring to a close our conversation this morning about the Kenya's aging society, before I let you go, our gerontologist, I have to say this. With only one gerontologist in the country, what does that say about the country in as far as the what would I call it, you know, wanting to help the elderly and also just interest in this field in support of the same?
Yeah, it says we have grown. How have we grown? There was probably no medical gerontologist before I was there. So it means the fact that actually the government is embracing this, it means it's also looking into issues of older persons, and it is preparing ground for growth. You'll be surprised to see maybe in another 2 years, a lot of capacity building has been done, because that is actually what the plan is. So a lot of health workers, to begin with, will be more responsive to the issues of older persons, and they will have a different attitude when dealing with older persons. So that tells you we're in a good place.
So steps in the right direction. Elijah Mweiga, I know you're very passionate about this. Your parting shot in as far as this is concerned.
One, I have to appreciate NTV for inviting us here, but also I tell the country that there is need to have social places for the older people. And Kenya is a good country where we need to grow old in a graceful way. And our young generation should start thinking on how empowering and preparing for their elderly age. Why I say this is because we have in every county a social hall for the youths. Tell me of a single county in Kenya which has a social amenity for the older people. What are we planning for our future? Our teacher told us a good leader always focuses on ahead of where he or she is reading. We as young generations, are we focusing on where we are heading? So my last word is that I started the Karika Daycare Center for the older people in Dagoretti, and I hope all the people of goodwill who would be willing to come and support this initiative are welcome. Finally, Dagoretti is not the only place older people are suffering. Can people of goodwill open up for our grandmothers and grandfathers who are really suffering within our society? Thank you very much for having me here.
Okay. And thank you for this, doing this and taking up this noble cause. Of course, if what you're doing was replicated in all counties, a lot would be done for the elderly. Now, Shosho Gertrude, what would you like to tell Kenyans in as far as taking care of the elderly and your needs?
Thank you so much. I just ask, begging, crying for youngsters to look after us, and appealing to those ones our age, not to take themselves they are dead, because when you are old you can do something. There are some even they are younger than me and they are useless. Don't make yourself, you old people or old persons, don't make yourself useless. Do something, think for something to be done in your life. Don't depend all the time. Be yourself as you depend on yourself, so that somebody can look at you and focus something good from you.
All right, well said. That is Shosho Gertrude Mwangi. Thank you for coming. Elijah Mweiga, founder Karika Kenya, and Dr. Muthoni Gichu, a medical gerontologist with the Ministry of Health. Thank you for your time. Of course, the conversation, Kenya's aging society, and there's been a great call there. Take the initiative as an elderly person, and of course those that are taking care of the elderly. Remember, what goes around comes around, so you might as well, you know, plant a good seed.